Okay, so we're going to start talking about spinal region lesions, and by a lesion we mean anything, any type of injury or illness that's causing a problem in the area. So first we're going to differentiate between segmental and tract lesions. So by segmental lesions we mean something that only affects one segment, one spinal cord segment. A tract lesion affects everything below the level of the lesion. So a segmental lesion might be something like a disc protrusion that is causing a nerve root compression. It only affects that spinal cord segment. At the level of the lesion, vertical tract function, vertical tracts are conveying ascending and descending information, and vertical tract lesions result in a loss of function everything below the level of the lesion. Okay? So segmental signs include abnormal or lost sensation in a dermatomal distribution or lower motor neuron signs in a myotomal distribution. So when we in the peripheral system, we talked about how peripheral lesions show up in a peripheral nerve distribution, while spinal lesions show up in a dermatomal or myotomal distribution. Okay? So there's two diagram 13 or figure 13-18. The first one that on the left side A shows a segmental lesion. It's right at C5. They put this little black bar to indicate where the lesion is, and it's only affecting that C5 myotome or dermatome. The second picture, it is a tract lesion that is affecting everything C5 and below. Okay? So, lesions that interrupt vertical tracts, they result in loss of communication to and or from the spinal level below the lesion. So, ascending tract signs include problems with sort of autonomic problems, regulation of blood pressure, sweating, and bowel and bladder control. Descending tract signs include paralysis, spasticity, muscle hypertonia, Babinski's sign, possibly if the lateral coracospinal tract is interrupted. So more of what we talked about for sort of like upper motor neuron signs. So all the signs of damage to the vertical tracts occur below the level of the lesion. So we talked a little bit about this in the peripheral chapter. Peripheral nerve lesions produce deficits in the distribution of a peripheral nerve. Altered or lost sensation in the peripheral nerve distribution, decrease or loss of muscle power, and no vertical tract signs, so nothing below that level. Spinal region segmental signs occur when nerve roots or spinal nerves are compromised. So, like I was saying, like a disc protrusion, something like that. So you get altered or lost sensation in a dermatome, decreased or lost muscle power in a myotome, or decreased or lost phasic stretch reflex. So, mainly peripheral regions in the peripheral nerve distribution, segmental or spinal lesions in a dermatomal or myotomal distribution. So, just the difference between those two. Vertical tract signs, on the other hand, you lose sensation or motor control below the level of the lesion. And you get also autonomic function. Excuse me. Autonomic function, loss of control of blood pressure or pelvic viscera or thermoregulation. So, excuse me. The upper motor neuron signs, you don't get those in peripheral lesions either. Spasticity, hypertonia, Babinski sign. And that is all we're going to talk about that.